Do you know the signs of diabetes you shouldn't ignore? Diabetes, a prevalent health concern around the globe, often sneaks up on us in subtle ways, making it crucial to recognize the early signs. An estimated 1 in 10 adults worldwide live with diabetes, many of them unaware of their condition. When left unchecked, this metabolic disorder can lead to serious complications, from heart disease to kidney damage. That's why early detection is so important. In this video, we're going to explore 12 signs of diabetes that you shouldn't overlook. These symptoms, while seemingly mundane, may be your body's way of signaling an underlying issue. We'll discuss each sign in detail, shedding light on why they occur and how they relate to diabetes. So, whether you're just curious or have concerns about your own health, this knowledge could be invaluable. Stay tuned as we delve into these 12 signs that might save your life. The first sign to look out for is increased thirst. Now, you might be thinking, I get thirsty all the time, especially after a workout or a hot day. That's normal. But when we talk about increased thirst as a sign of diabetes, we mean an excessive thirst that's not usually quenched by drinking, even when you're not exerting yourself physically or exposed to heat. Here's why. When there's too much sugar in your bloodstream, your kidneys work overtime to filter and absorb the excess sugar. But if they can't keep up, the excess sugar is excreted into your urine, dragging along fluids from your tissues. This triggers more frequent urination, which may leave you dehydrated, and thus you might feel thirsty more often. Our bodies are incredibly smart, aren't they? They use thirst as a way to replenish the lost fluid and maintain a balanced state. So, if you find yourself reaching for a water bottle more often, take note. The second sign is frequent urination. Now, this is where the plot thickens. You see, increased thirst and frequent urination are two sides of the same coin when it comes to diabetes. Here's the catch. When you have diabetes, excess glucose or sugar builds up in your blood. Your kidneys are forced to work overtime to filter and absorb the excess sugar. But if your kidneys can't keep up, the excess sugar is excreted into your urine, dragging along fluids from your tissues. This triggers more frequent urination, which may leave you dehydrated. As you drink more fluids to quench your thirst, you'll urinate even more. So it's like a never-ending cycle. More sugar leads to more urination, which leads to more thirst, and the cycle repeats. This is your body's way of trying to get rid of that extra glucose. If bathroom trips seem more frequent, it may be time to consult your doctor. The third sign to be aware of is constant hunger. Imagine having a big meal, feeling full, and then, not long after, your stomach's rumbling again. It's like your body's never satisfied, no matter how much food you put into it. This isn't just about having a big appetite or loving food a bit too much. It's about an insatiable, persistent hunger, one that doesn't seem to make sense. Now let's think about why this could be happening. You see, when you have diabetes, your body struggles to use food for energy the way it should. The glucose from the food you eat should be going into your cells to give them energy. But with diabetes, this process gets disrupted. The glucose can't get into the cells properly, so you're left feeling hungry, even if you've just eaten. It's like your body's sending out an SOS, saying it needs more fuel. Feeling hungry all the time despite eating well, it could be a sign. Sign number 4 is unexplained weight loss. This might sound appealing to some, but in the context of diabetes, it's a cause for concern. When your body can't effectively use glucose due to an insulin imbalance, it's forced to burn fat and muscle for energy instead. This can lead to sudden and unanticipated weight loss. It's important to note that this isn't the kind of weight loss that comes from a balanced diet and regular exercise. It's the kind that happens without trying, and it doesn't discriminate between fat and muscle. That's why it can be so detrimental to overall health. While everyone's weight can fluctuate a bit from day to day, significant weight loss that can't be traced back to changes in your diet, exercise, or lifestyle should be taken seriously. It's one of the many ways your body might be trying to signal that something's not quite right. If you're losing weight without trying, it might be time to investigate. The fifth sign is fatigue. Now, we're not talking about the usual tiredness that comes after a long day at work or a strenuous workout. This is a deep-seated persistent fatigue that doesn't seem to go away even with adequate rest. You see, when your body's cells can't properly absorb glucose due to insulin resistance, they're not getting the fuel they need to function optimally. This can result in a feeling of constant exhaustion. Additionally, high blood sugar levels can lead to inflammation, which can also make you feel worn out. Your body might be working overtime trying to deal with the excess sugar in your bloodstream. This tiresome battle can take a toll on your energy levels, making you feel tired more often than not. So if you find yourself constantly feeling drained, it could be more than just the hustle and bustle of daily life. It might be your body's way of signaling an underlying issue. If you're feeling constantly tired, don't just chalk it up to a busy schedule. Sign number 6 is blurred vision. Now, it might be easy to dismiss this as a sign of aging or needing a new pair of glasses. However, it's essential to understand that high blood sugar levels can impact your eyesight, leading to blurry vision. When your blood sugar levels rise, they cause the lens in your eyes to swell. This change in shape affects your eye's ability to focus, resulting in blurred vision. This isn't a permanent condition, and it can improve as your blood sugar levels stabilize. However, if left unchecked, high blood sugar can lead to severe eye conditions, including glaucoma and cataracts. It's worth noting that diabetes is the leading cause of new cases of blindness among adults. So, if you notice that your vision seems off, don't just chalk it up to a long day or needing new glasses. It could be a sign of something more serious. If your vision seems off, don't ignore it. The 7th sign is slow healing. Now, let's delve into why this happens. When blood sugar levels are consistently high, it can cause a slew of issues, one of which is hampering the body's natural healing process. Elevated sugar levels can cause damage to blood vessels and nerves over time, which in turn can restrict blood flow. And without proper blood flow, your body has a tougher time sending important nutrients and immune cells to the site of injury. This means that wounds, cuts, or grazes may take longer than usual to heal. Not only that, but high blood sugar can also increase the risk of infection in these wounds, further delaying the healing process. So, if you notice that your wounds are taking an unusually long time to heal or frequently become infected, don't dismiss it as a mere coincidence. It could be a red flag. If your wounds are taking longer to heal, it could be a red flag. The 8th sign is frequent infections. Now you might be wondering, how does diabetes tie into this? Well, high blood sugar levels can take a toll on your immune system, impairing its ability to fight off infections. When your body has to constantly combat high sugar levels, it's like a soldier fighting on multiple fronts. It can get overwhelmed. This can lead to a weakened immune response, making you more susceptible to various infections. You might notice recurring skin infections, urinary tract infections, or even yeast infections. These could be minor or more severe, but the key point here is frequency. If you're falling ill more often than you used to, and the infections seem to linger longer than they should, it might be a sign that your body is struggling against elevated sugar levels. This interruption in your body's natural defense mechanism is another crucial sign of diabetes that shouldn't be overlooked. If you're getting sick more often than usual, it's worth paying attention. Sign number 9 is tingling or numbness. It's more than just a foot falling asleep after you've been sitting in a weird position. It's a persistent sensation that can signal something more serious. High blood sugar levels, often found in people with diabetes, can cause nerve damage. This damage most frequently occurs in the hands and feet, leading to a feeling of tingling or numbness that simply won't go away. Imagine the sensation of pins and needles, but without the temporary relief that comes from shaking out your hand or stomping your foot. This uncomfortable feeling can be a constant companion if your blood sugar levels are consistently high, and it's a sign that shouldn't be ignored. It's your body's way of telling you that something isn't right. So don't let these sensations go unaddressed. If you're experiencing any unusual sensations like persistent tingling or numbness, it's time to speak up. Seek medical advice because it could be a sign of diabetes. The 10th sign is dark skin patches. This might sound unusual, but diabetes can indeed cause dark areas on your skin. This condition is known as acanthosis nigricans, where the skin in certain areas such as the neck, armpits, or even the groin becomes darker, thicker, and may feel velvety. Now you might wonder, how does diabetes lead to this? Well, insulin resistance, a key factor in diabetes, can often result in excessive insulin in your bloodstream. This excess insulin can stimulate the skin cells to reproduce at an abnormal rate, leading to these dark patches. However, it's important to note that acanthosis nigricans can also be a symptom of other conditions like hormonal disorders, or even certain types of cancer. So if you're noticing these dark patches, it's not just about diabetes. A visit to a healthcare professional can help identify the root cause. Remember, your skin is the largest organ of your body, and it often reflects your overall health. If you notice any unusual skin changes, don't ignore them. The 11th sign is irritability. Yes, you heard it right. Your mood isn't just influenced by what's happening around you, but also by what's happening inside you. When your body is dealing with fluctuating blood sugar levels, as it often does in diabetes, it can lead to mood swings and increased irritability. Here's why. Blood sugar levels that are too high or too low can affect your body's ability to function properly. This includes the brain, which relies on glucose to fuel its activities. When there's too much or too little glucose in your bloodstream, it can impact your brain's functioning, leading to changes in mood, including irritability. This irritability might show up as a short temper, frustration over small issues, or an inability to deal with stress. It's not just about being in a bad mood. It's a physiological response to what's happening in your body. So, if you're feeling unusually irritable, it might be more than just a bad day. The 12th and final sign is red or swollen gums. Now you might wonder, what do gums have to do with diabetes? Well, a lot more than you might think. When blood sugar levels are high, our bodies become less capable of fighting off infections. This includes infections in the mouth and gums. The sugar in your bloodstream feeds the bacteria in your mouth, making them more active and more difficult to control. This can lead to gingivitis, an early stage of gum disease, or periodontitis, a more serious gum infection that can lead to tooth loss. Also, inflammation in the body, a common side effect of high blood sugar, can cause your gums to swell and become red. It's a vicious cycle, where diabetes weakens your body's defense system, making it easier for infections to take hold and thrive. So, if your gums are giving you trouble, it's time to book a doctor's appointment. So, those were the 12 signs of diabetes you shouldn't ignore. As we journeyed through this important discussion, we've highlighted these critical signs that your body may be trying to communicate something crucial to you. Let's take a moment to recap, as understanding these signs could be a lifesaver. We began with increased thirst, which might seem innocuous but could indicate your body's struggle to regulate sugar levels. Then we moved on to frequent urination, another sign that your body might be trying to remove excess sugar. Constant hunger, even after eating, could be a signal that your cells aren't receiving enough glucose for energy. Unexplained weight loss, despite increased hunger, is another potential warning sign. Fatigue or feeling constantly tired could mean your body isn't effectively converting food into energy. Blurred vision can occur when high blood sugar levels cause the lenses in your eyes to swell, altering your ability to see. Slow healing of cuts and wounds, followed by frequent infections, could mean your immune system is compromised due to high sugar levels. Tingling or numbness in your hands or feet, often referred to as neuropathy, can be a result of nerve damage from prolonged elevated blood sugar levels. Dark skin patches, a sign of a condition called acanthosis nigricans, can indicate insulin resistance. Irritability may also be a sign, as fluctuating sugar levels can impact your mood. Lastly, we talked about red or swollen gums, which could be a sign of gum disease, another potential complication of diabetes. Remember, these signs are not definitive proof of diabetes, but they are signals that your body might not be functioning optimally. If you're experiencing any of these symptoms, it's essential to consult a healthcare professional. Early detection is key in managing diabetes, and the sooner you act, the better your chances of maintaining a healthy life. Remember, your health is your wealth. Stay informed, stay safe, and take care of yourself.